Hey everyone, it's Razmeen, and welcome back to the channel. Today we're diving deep into a rare but serious condition that you absolutely need to know about, especially if you're in the medical field, Guillain-Barré Syndrome. Guillain-Barré Syndrome, or GBS for short, is an autoimmune disorder that affects the peripheral nervous system. In simpler terms, it's like your body's own defense system, the immune system, mistakenly attacks the nerves that control your muscles. This can lead to a whole cascade of problems, from muscle weakness and tingling to even paralysis in severe cases. Now, I know this might sound scary, but trust me, we're going to break it down step by step. We'll cover everything from what causes GBS and the telltale signs to how it's diagnosed, treated, and most importantly, how to provide the best possible care for your patients. So, buckle up, grab your notebooks, and let's get started. Alright, let's start by understanding what exactly Guillain-Barré Syndrome is. Imagine your nerves as electrical wires, and the myelin sheath as the insulation that surrounds them, allowing electrical signals to travel quickly and smoothly. In GBS, your immune system mistakenly attacks this myelin sheath, causing inflammation and damage. This damage disrupts the transmission of nerve signals, leading to a variety of symptoms, with the most common one being muscle weakness. And here's the thing about GBS. It typically starts in the legs and feet and then spreads upwards, a pattern we call ascending paralysis. This can happen rapidly, sometimes over just a few hours or days. Now, the exact cause of this immune system malfunction is still a bit of a mystery, but we do know that it's often triggered by an infection. Think of it like this. Your immune system, while fighting off an infection, gets a little confused and accidentally attacks your own nerves in the process. Some common culprits include bacterial infections like Campylobacter jejuni, viral infections like the flu or Epstein-Barr virus, and even, in rare cases, recent vaccinations. Early recognition of Guillain-Barré syndrome is crucial. Remember, time is of the essence here. So what are the red flags to watch out for? Well, it often starts with subtle symptoms like tingling or a pins and needles sensation in your fingers and toes. You might also notice some muscle weakness, making it difficult to climb stairs or even walk steadily. As GBS progresses, these symptoms can intensify, and the weakness starts to climb upwards, affecting your arms, torso, and even your face. This can lead to difficulty breathing, speaking clearly, and swallowing. In severe cases, patients might experience paralysis and require mechanical ventilation to help them breathe. Now, here's the good news. Most people with GBS eventually recover, although it can be a long and challenging journey. The recovery phase can take weeks, months, or even years, and some individuals may experience lingering weakness or other neurological issues. Diagnosing Guillain-Barré syndrome can be tricky, as its symptoms can mimic other neurological conditions. It often involves a combination of patient history, physical examination, and some key diagnostic tests. One of the most important tests is a lumbar puncture, also known as a spinal tap. This involves collecting a sample of cerebrospinal fluid, the fluid that surrounds your brain and spinal cord. In GBS, we typically see elevated protein levels in the CSF, even though the white blood cell count remains normal. This finding is a telltale sign of GBS. In addition to a lumbar puncture, we also use electromyography, EMG, and nerve conduction studies, NCS, to assess how well your nerves are conducting electrical signals. These tests help confirm the diagnosis and determine the extent of nerve damage. Now, let's talk about treatment. Unfortunately, there's no magic cure for Guillain-Barré syndrome. However, we have effective treatments that can speed up recovery and reduce the severity of symptoms. The goal is to support the body's natural healing process while managing the complications. One of the mainstays of treatment is intravenous immunoglobulin, or IVIG for short. It's basically like giving your body a boost of healthy antibodies to fight off the harmful ones that are attacking your nerves. Another effective treatment is plasmapheresis, also known as plasma exchange. This procedure involves removing and filtering your blood plasma to remove the harmful antibodies. Beyond these specific treatments, supportive care is crucial. This might include mechanical ventilation for patients with difficulty breathing, medications to prevent blood clots, pain management, and physical therapy to help regain muscle strength and coordination. For all my nurses out there, caring for a patient with Guillain-Barré syndrome can be incredibly demanding, but also incredibly rewarding. Remember, you play a vital role in their recovery and well-being. First and foremost, prioritize their airway and breathing. closely monitor their respiratory rate, oxygen saturation, and lung sounds. Be prepared for potential respiratory failure and the need for intubation and mechanical ventilation. Early recognition and intervention are key. Preventing complications is another crucial aspect of GBS care. These patients are at risk for blood clots, pressure ulcers, and muscle contractures. Make sure to implement preventive measures like frequent position changes, compression stockings, and range of motion exercises. Now, for those of you studying for the NCLEX, understanding Guillain-Barré Syndrome is essential. You'll likely encounter questions about its pathophysiology, signs and symptoms, diagnosis, and most importantly, nursing care. Remember, the NCLEX loves to test your prioritization skills. So when it comes to GBS, always prioritize respiratory function. Know the early signs of respiratory distress and be prepared to intervene promptly. Another high-yield area is understanding the key diagnostic findings in GBS, particularly the CSF analysis showing elevated protein with normal white blood cell count. Be familiar with the different treatment modalities, especially IVIG and plasmapheresis, and their potential side effects. That was a quick but comprehensive overview of Guillain-Barré Syndrome. As you can see, it's a complex condition, but with the right knowledge and skills, you can make a world of difference in the lives of your patients. Remember, early recognition, prompt treatment, and compassionate care are paramount. By staying informed and vigilant, we can help individuals with GBS navigate this challenging condition and achieve the best possible outcomes. If you found this video helpful, be sure to give it a thumbs up, share it with your colleagues, and subscribe to the channel for more informative medical content. Until next time, stay curious, stay informed, and keep learning.